Well, as COVID cases climb all across the country, there is a growing debate about isolation time for fully vaccinated people who test positive. The United Kingdom has already shortened its self-isolation period. So what about here in this country? Channel 3 Eyewitness News reporter Aya Galal has more on the potential risks and benefits.
And what we want to make sure about is that it would be safe to reduce either the quarantine or the isolation period or both.
It's a debate happening right now within the medical community. Should the isolation period for fully vaccinated people who get COVID be shortened? According to current guidance from the CDC, anyone who tests positive for COVID should isolate for 10 days. One of the benefits to shortening the isolation period is that people can return to work sooner. It would also be incentive for people to not be misleading about their illness, according to doctors.
But that's exactly the work and analysis that's taking place right now. If it's safe to shorten that period, we will. And that will actually be another step toward helping protect our workplaces, especially our healthcare workforce.
As of today, the United Kingdom shortened its isolation period from 10 to 7 days if the person has 2 negative COVID tests taken 24 hours apart. Dr. Ulysses Wu is Assistant Director of Infectious Diseases and Chief Epidemiologist with Hartford Healthcare. We asked about his thoughts on this debate.
I'm not in favor of actually having people return back to the workforce earlier, unless for 2 things. Number one, we can say that the infectivity period is less than 10 days.
The other is masking, which he says would be difficult to enforce. He adds that if there isn't masking compliance, reducing that isolation period would result in a rise in cases. In Hartford, Aya Galal, Channel 3 Eyewitness News.